Welcome to this presentation on home health care given to patients. Home care services are provided by home care organizations. Home care is not an actual facility, but allows patients to remain in their homes while they receive care of healthcare providers. The home care provider visits the patient's home on a scheduled basis and provides services that are ordered by a physician. These services are called skilled care, and they are under the supervision of a nurse, physical, occupational, or speech therapist. Types of skilled care include assessment and monitoring of an illness, IV and medication administration, insertion of catheters, tube feedings, and wound care. Homemaker and home care aid agencies provide homemakers or chore workers. They assist with everyday chores such as housekeeping, bathing, dressing, and preparing meals. They assign people to work depending on the needs of the family or client. Some states require they be licensed and meet minimum standards established by the state. Staffing and private duty agencies provide nursing services along with homemaker services. The nurses can assess the client and ensure the personnel are properly assigned and provide ongoing supervision. Hospice care provides comprehensive medical and supportive social, emotional, and spiritual care to terminally ill patients and their families. The goal of hospice care is what we call palliative care for comfort management care. Most hospice care is provided in the home, but can also be performed in a hospice care facility. Home health care also covers the use of DME or durable medical equipment. That includes items such as canes, hospital beds, oxygen, walkers, and wheelchairs, just to name a few. The DME providers employ staff who deliver and install these products, as well as instruct patients on how to use them. There are also home health providers that provide home infusion care to patients. This is where patients receive intravenous administration of medication at home that is appropriate for their condition. Examples of infusion therapy include chemotherapy, drug therapy, pain management, hydration therapy, TPN, or total parenteral nutrition to prevent patients from being malnourished. The next series of slides will discuss the documentation contained in home care medical records for patients. Referral information is important to document in a home care medical record. Normally, some type of exam or assessment is given to the patient as well. If the patient does not qualify for home services or is not accepted by a home care provider, that should be documented as well. The initial assessment can also list any physical limitations of the patient to help assess whether or not they are a candidate for home health care. Home care services have documentation that is unique to them. Patients have the same patient care rights as when they visit an actual healthcare facility. It is important to any home provider to explain the rights to patients so that they can be actively involved in their care. Anytime they visit patients in their home, the home provider needs to document problems of the patient, both existing and no longer existing. They also need to perform a comprehensive assessment once they accept the care for the patient. The initial assessment mentioned earlier in the presentation is for a basic evaluation. The home care provider needs to establish their own updates and documentation intervals. However, OASIS is a tool that provides them with guidance in terms of documentation. That is discussed briefly on the next slide. Medicare certified home health agencies use the Outcome and Assessment Information Set for reporting data elements required by CMS. Any home health agency seeking Medicare certification is required to meet the Medicare conditions of participation prior to certification. This includes compliance with the OASIS collection and transmission requirements. OASIS items measure changes in a patient's health status between 2 or more points. It measures both outcomes and patient risk factors. Data items include socio-demographic, environmental, support system, health status, functional status, and health service utilization of a patient. The data is collected at the start date of care, at 60-day follow-ups, and at discharge. In order for home health agencies to get paid for their Medicare patients, they must be compliant with OASIS. Hospice assessments involve the elements listed on this slide. Since this type of care is normally for terminally ill patients, they need to assess based on some different needs of the patient and their family. As mentioned earlier in the presentation, they provide palliative care, which is comfort care. Hospice providers would be concerned as to the level of pain a patient is experiencing. They would assess pain levels as they would vital signs. Increased pain would require some intervention to make the patient more comfortable. It is also important to assess the spiritual needs of the patient. That allows the caregivers to understand the patient's religious beliefs and their wishes. They can also refer a chaplain or spiritual advisor for the patient if requested. Home health care records are centered around physicians' orders for treatment at home. CMS has standardized the details that are required about a patient's home care. The nurses or therapists visiting the patient at home keep notes from each visit concerning the services performed and the patient's progress. These are updated in records maintained by the home care agency. Physician orders must be signed, dated, and timed as in acute records. CMS requires a request for anticipated payment, or RAP, to be submitted by home health agencies in order to receive payment. The RAP contains data fields that must be completed accurately. Some of these data fields are patient demographics, agency information, and clinical information on the patient, such as ICD-9 codes. Home health records contain both clinical and progress notes. The clinical notes document the care given to the patient, while the progress notes document the summary of the care and how the patient is progressing. Each visit must be documented to include conversations with the family about how the patient is doing. All of this documentation helps the home providers decide on treatment plans for the patient. Dietary and nutritional information is also important in home health records. Some patients are on special diets that require constant monitoring. Their nutritional intake is crucial in helping to determine if they can become malnourished or need special care. Providers must also note their diet history between visits. If they notice a decrease in appetite, for example, they can determine what the cause may be and make adjustments to medications. Medicare provides a hospice benefit to many of its subscribers. A physician must certify a patient has a terminal illness or has 6 months or less to live. The hospice facility must also be Medicare certified to provide hospice care. There is a hospice physician and nurse available 24 hours a day, 7 days a week. All other medical services are still covered by Medicare as well. All other medical care outside of hospice care must be coordinated through the hospice provider. The Tax Equity and Fiscal Responsibility Act of 1982 provides for state Medicaid coverage for disabled children. A physician must certify a child as being disabled in order to receive the coverage. The care is given in the home of the child if medically necessary. The qualifications to receive this benefit are listed on this slide. The child must be under 19 and show a financial need. The parent's income and assets are not considered, so the children normally can qualify on their own. Medicare has a home care benefit policy manual. This outlines the home care program for Medicare patients and their families. To receive this benefit, a patient must be under the care of a doctor who determines they need services. The services must be provided by a Medicare certified home provider. A patient also must be certified as being homebound. To be homebound means leaving your home is not recommended because of the patient's condition. A patient has a condition that prevents them from leaving home without help, such as help from another person, wheelchair, or walker. And lastly, leaving home takes a considerable and taxing effort for the patient. If a patient meets these conditions, Medicare will pay for the covered home health services. Physicians must recertify patients every 60 days and update their plan of care and goals through documentation. There are also some skilled services that can be given to patients in the home. They must be ordered by a physician and supervised by a physician, nurse, or allied health practitioner to include physical, occupational, or speech therapists. The services must be reasonable and necessary in terms of the diagnosis of the patient. Medicare can survey home care agencies just as they certify hospital and nursing homes. The auditor or surveyor reviews medical record documentation to determine compliance with standards. There are certain indicators they will look for. And remember the phrase, if it was not documented, it was not done. That holds true for any type of documentation, regardless of the healthcare setting. There is a tool or home health functional assessment they will refer to when conducting the survey. The tool contains different modules that must be completed on the patient. Home health providers are mainly focused on taking care of patients. At the same time, they are not able to provide the care if they are not fiscally able to do so. In other words, they need to make money in order to stay in business. This slide lists some of the important items that need to be captured and documented in order for home providers to receive reimbursement from insurance companies. It is important they have a sound medical record for each patient that is very detailed in recording all care given. They must also show justification on why services were provided based on the patient's illness. Covering all of the required items on this slide will ensure the home provider will in fact receive payment for services rendered. A qualitative analysis of medical records must be performed even at home health providers. Audits need to be performed initially when accepting a patient, ongoing while the patient is receiving services, and after discharge of the patient. A good practice is to audit records based on the detailed bill of the patient. Every item or service charged should be documented in the medical record. Physician documentation needs to be audited as well, not only for signatures and completion of documentation, but for documentation of medical necessity for patients as well. Legally, patients in home care or hospice care need to be informed of their rights. Just as in a hospital setting, they have a right to choose or refuse care and ask questions. This is spelled out in the Patient Self-Determination Act. This law was passed in 1991 in order to provide patients' rights in regards to their medical care. They have the right to refuse treatment and the right to initiate an advance directive. An advance directive is a legal document that the patient signs in the presence of a witness, specifying what wishes they have in the event they become incapacitated and cannot make decisions on their own. The patient can also specify an individual they wish to make healthcare decisions on their behalf as part of the advance directive. In most states, an advance directive is two parts: a living will and a durable power of attorney for health care. It is imperative patients discuss both documents with their family members so they understand their wishes in the event they are on life support, for example. It is difficult for family members to decide if life support should keep a family member alive indefinitely, if they are declared brain dead, or if they should allow their family member to die naturally. Lastly, for this presentation, Medicare has a conditions of participation for hospices. Just as for hospitals, the conditions of participation outlines the required standards hospice centers need in order to be in compliance with Medicare or CMS. They require different monitoring items in order to identify deficiencies and improve patient care. That concludes this presentation.